Good afternoon to everyone who has joined us today in person and online. We are so grateful, again, that you've chosen to spend time with us together as we embark on a journey to 30 days to revolutionize your health. Before we begin the program and I introduce our guest speaker, let's have a word of prayer. Dear Father God, we thank you once again for this beautiful day. We thank you for life. We thank you for your love. We thank you just for being such a faithful Father to us. And so now we invite your presence into this place. We ask that you would just be with each person, again, who is in person here, those who are watching online, that you would give us understanding, give us ears that can hear, and a mind that can comprehend the information, Lord, that is to benefit us in our health. And that you would just be with us, be with the guest speaker, and we just, again, invite your presence to be with us throughout the entire 30 days to revolutionize our health and beyond. In Jesus' name I pray, amen. So over the next 4 weeks, we are going to have life-transforming health information shared with us by Dr. Hdl Durant, who is a medical doctor and anesthesiologist who's been practicing in Indianapolis and the surrounding areas for the past 28 years. After obtaining her medical doctorate degree from Indiana University, IU, in 2000, she completed 4 years of training at IU before joining a large private practice in Indianapolis, Anesthesia Consultants of Indianapolis, ACI. She worked in this practice for 17 years before recently joining Indiana University Health Physicians. In addition to her work as an anesthesiologist, she enjoys imparting knowledge about preventative health and wellness to relatives, friends, and her church community. She's been married for 30 years to Robert Durant, and they have 3 children, Avery, age 21, Renelle, age 18, and Aiden, 15. Please join me in welcoming Dr. Durant.
Thank you, Cynthia, for that very warm introduction. I'm delighted to be here. These topics are so important that it's always worth the effort to teach people about their health and to just remind others, as I remind myself, of the changes that we need to make, because the Lord, He wants us to be in good health, and He wants us to have that health now and to prosper and to be a living witness for Him. And the best way to be a witness is if we are exemplifying the principles that we talk about, and if we ourselves are in good health. So let's go ahead and dive into this. Just to answer a question that was asked last Sabbath afternoon, one of the questions that came from the audience was concerning water, the best water. And those of you who have not had a chance to listen to presentation number 1, it was last week, Sabbath afternoon, and started to talk about rheology and the Methuselah Factor and what it actually means. So it would be helpful, even though I'm going to do a brief review, to look at the first tape. And then the second tape was on Wednesday evening, and we continued talking a little bit about cancer. And so we're going to continue today with part 3. But before that, I wanted to address one of the questions that was asked last week by one of the audience members. The question was concerning the best type of water to drink. And just from the research that I did, first of all, there was some conflict in terms of what they were saying was the best type of water. So from what I was able to gather and what I came up with, distilled water, which is very similar to rainwater, or water that is filtered by reverse osmosis, those are the best type of water to drink. And if you must buy water, like if you're out somewhere and you need to buy water, or it's so convenient sometimes to just have water out, then it's important that it's in a glass container. The other type of water that's also going to be very healthy for you, for me, spring water or mineral water. So water that has minerals added. There's no evidence that reverse osmosis water leaches minerals out of our system. That was part of the argument for why people are saying don't use reverse osmosis water, but there's no evidence to suggest that it leaches minerals out of our systems. City water or municipal water, sometimes it has too much chlorine or too much fluoride, and they're always battling and striving to achieve the right balance. So we don't really know sometimes what's going on with the city water. Also has calcium and magnesium, which makes it hard water, and then our whole pipe system is aging from city to city. So you can also have lead contamination in the water, and you don't really know when this is going to happen. You don't taste it, but we do know that it affects the brain, especially of children, and that could be very dangerous. So spring water, mineral water, well water, these are good waters as well. If they're not contaminated, they're very good sources of water. If it's store-bought, then artesian water or spring water sold in bottles that has natural minerals. If your body is very acidic, then alkaline water may be helpful, but most of us don't have really acidic bodies, so that's not necessarily necessary to buy alkaline water, although that is the craze of today, alkaline water. Manufacturers put additional minerals in the water to influence the taste. The bottom line is choose the water that tastes the best to you and make sure you're drinking and you're consuming it in enough quantities. And in terms of the quantities, we talked about the first challenge being water up, 6 to 8 ounces of water, 6 to 8 glasses of water a day, or your ideal body weight. Your ideal body weight in pounds divided by 2. So in other words, if you weigh 100, if you're supposed to weigh 100 pounds and you divide that in 2, that's 50. You need to drink 50 ounces of water per day. So your ideal body weight divided by 2, and that amount in ounces is what you're supposed to drink a day. Most importantly, stay away from water that's sold in plastic containers. Do your best to avoid plastic bottled water because there are 2 reasons. The presence of microplastics. This was really kind of the most important thing that I gleaned from this research, is that microplastics in water is real. There's a lot of contamination of plastics in the water that comes from plastic water bottles. And if the pieces of plastic are really small, like less than 150 microns, they're small enough to go through the blood vessels that surround the stomach when you're absorbing food, and they too can be absorbed, the plastic. And then the first big organ that receives the blood that's coming from your gut is the liver. And so it increases the risk of liver cancer. So when they fed plastic to fish, then just as a research, the fish developed more liver cancer. So that's the important thing to remember, is to try to stay away from water that is served in plastic, because the plastic can leach into the water. And also the same goes for storing your food or microwaving your food in plastic containers. And even styrofoam cups is not really supposed to be that safe. So 1, you have microplastics, which are very harmful to our bodies, and 2, plastics end up in the ocean and the landfills, and we're creating a lot of waste. The fishes are encountering the plastics, the seafood, and if you can have a filtered system in your home, the outlay of funds initially is going to be more expensive, but in the long run, you save a lot of money, and you're helping the environment by not disposing of 5 water bottles a day, which is kind of what you're supposed to be drinking, 4 to 5 water bottles a day. All right, so let's move on to the Methuselah Factor. We're going to talk a little bit about diabetes. We're using the book, The Methuselah Factor by David D. Rose, who's an Adventist physician who currently practices in California. He's a board-certified internal medicine physician and also board-certified in preventative medicine. So he has a wealth of experience and knowledge in terms of treating patients, not just with conventional medicine, but with natural medicine and using products and using the Lord's way to try and heal our bodies. Let food be your medicine. So we talked about the factors that influence hemorrheology in isolation. So we talked about red blood cell volume or CRIT. We talked about plasma viscosity. You can move to slide 3. We talked about erythrocyte or red blood cell aggregation and fibrinogen levels. We talked about that. And then on Wednesday evening, we talked about these things last Sabbath. The importance of not having too high a hematocrit, okay? One of the things that influences hematocrit, I'm just gonna throw this in there, is smoking. So whereas normal hematocrit may be between 12 and 14, I've taken care of a young man who came in smoker, heavy smoker. Hematocrit was 18, very high. It may seem like, okay, it's great, you have all these red blood cells, it's gonna carry more oxygen, you have more energy, but the truth is that that puts that person at very high risk for having a stroke because they have too many cells per fluid, okay? So the hematocrit percentage is too high, and you're gonna, because of that, then it puts you up, you have higher viscosity, okay? And then because of that, you have higher erythrocyte aggregation, or the red blood cells are gonna tend to clump together, all right? And those things trigger the fibrinogen coming into play, and you have higher risk of clots, and that's gonna put you up for, or set you up for having increased risk of stroke and increased risk of heart attacks. So those were the 4 factors that we reviewed last Sabbath that when they are in imbalance, it puts you up for having increased risk of stroke and heart attacks. And then on Wednesday, we talked about platelets. Platelets, the role that they play in forming blood clots and also in camouflaging cancer cells, and how high platelet count, when you have a high platelet count, it increases your risk of developing cancer, believe it or not. And if you have had cancer, then having a high platelet count increases your risk of having metastasis, okay? Because the platelets, they literally can camouflage the cancer cells. And because platelets cause clots, they can inhibit blood flow in the area where those cells are settling and give the cancer cells a chance to have a foothold in distant areas from where the primary cancer was. And through that mechanism, you can increase your risk of cancers and metastatic disease if you have too many platelets, or if your platelets are overactive or too sticky. So those are the things we talked about on last Sabbath and on Wednesday. We haven't talked about something that can raise the levels of the Methuselah Factor components, all of them. And this is inflammation. So let's tie everything together and try to help you understand some connections. And we'll talk about diabetes. I'm gonna try and go slow and repeat. If you feel like you're not understanding something, put your hand up and let me go over it, because it's kind of, there's a lot of physiology involved. Physiology just means we're talking about what happens in the body on a cellular level that causes the manifestations that you see in a person that has diabetes, okay? How it starts. All right, so diabetes and inflammation. So most people think of diabetes as a problem that's due to insufficient insulin production. That's what we think about when we hear diabetes. They don't have enough insulin. Because what medication do diabetics take all the time? What's one of the main medications that a diabetic is gonna take if they're at the end of their diabetes? Insulin, right? So it's natural, it makes sense. Okay, well, you're giving them insulin. Obviously, they don't have enough insulin. So there's some truth in that, but it largely kind of misses the most important aspects of the causes and the treatment of diabetes as well. So there are 2 types of diabetes. The first type of diabetes, type 1, is responsible for a very small percentage of cases in the US, 5 to 10% of cases. It's known as juvenile diabetes. The root cause is insufficient insulin production. So this is true. These people truly do not have enough insulin. And the reason they don't have enough insulin is because sometime in their childhood, and most times we don't really know when it happened, but there was a foreign protein, in other words, a viral or bacterial infection that triggered an immune response and the target of the immune response ended up destroying the beta cells in the pancreas. So it happened in childhood, and then at age 9 or 12 or 13 or whatever the age is, all of a sudden they're getting really thirsty. They're going to urinate all the time. Mom takes them to the ER, pediatrician, and they check a blood sugar, and the blood sugar is out of control. And they find out that they have diabetes, and it's juvenile onset diabetes, okay? So insulin production ceases pretty much because you have destruction of the beta cells in the pancreas. And this type of diabetes, there is no cure. It's irreversible. And so they need insulin for the rest of their lives. And the only cure for this type of diabetes would be if they receive a pancreas transplant. And it's wonderful what the transplant surgeons are doing. They're transplanting pancreases. They're transplanting small intestines now and stomachs. They're transplanting livers. Okay, it used to be that having cirrhosis was a death sentence, even if you were an alcoholic. I've met alcoholics who destroyed their liver, stopped drinking, and then were able to receive a transplant. And they have a new lease on life. I've met smokers who had end-stage COPD or emphysema who receive lung transplants as well. So there's a lot of stuff that's going on in the transplant field, which is a blessing to those patients. Usually they have to have stopped doing whatever they were doing, but they get to have a second lease on life, and that's good for them. So that's type 1 diabetes. Juvenile onset, they actually don't have insulin because they have destroyed the cells in the pancreas that make insulin. Now, there's a second type of diabetes. It's called type 2 diabetes. This accounts for like 90 to 95% of cases in the U.S. And the majority of cases worldwide is caused by type 2 diabetes. Used to be known as adult onset diabetes. And why I say used to be known as adult onset diabetes is because we're having so much problems with obesity in teenagers that now we're having teenage onset type 2 diabetes instead of type 1. So accounts for 90 to 95% of cases in the US, and it has a totally different root cause. So the root cause of type 2 diabetes is insulin resistance instead of having no insulin. Your body's actually resistant to the insulin. So what is insulin resistance? Insulin is not working as it should. It's just the body has become resistant to the insulin. Slide, please. Insulin is kind of like a doorman. It opens doors in our cells that allow, listen to this analogy. Insulin is like the doorman. It opens our cells, it opens the doors in our cells that allow sugar to leave the bloodstream and go into the cells. So sugar is leaving the bloodstream and going into the cells where it's used to do work. It's used to help with all the processes in the body that we need in order to stay alive, okay? So it's used for fuel. With insulin resistance, you're having insulin is like the doors are not working properly. You have rusted hinges, all right? So the insulin is not opening the door like it should. The door is kind of rusty. The hinges are not working. And now these damaged doors are now extremely difficult to open and require more than one doorman to pry them ajar and allow the blood sugar to get into the cells. So instead of having one doorman or one molecule of insulin to open up that door and allow a couple of glucose molecules to go from the bloodstream to the cells, now you need multiple. You may need 10 doormen to open up the door. So the pancreas is still the main organ that makes insulin. And insulin is that little purple ball. And now the cells are turning their noses away up. They're turning their noses up at the insulin. They're like, you're not gonna work on us. And so what happens is that the sugar can't get out of the bloodstream to go into the cells. And it stays in the bloodstream and it is stored as fat, okay? Whatever's not used up is gonna be stored as fat. And as a result, you feel hungry, you feel tired, it messes with your hormones, it messes with your weight, it just messes with everything. So when you are diagnosed with, when you start to have insulin resistance, the body sends more doormen to overcome the effects of insulin resistance. So one insulin did not do the job that it was supposed to do, so out come several other doormen from the pancreas, and they're all trying to get into these cells, and the cells are like, no, okay? And so after a while, you begin to gain a lot of weight, and that's all that sort of stuff happens. Before you are diagnosed with type 2 diabetes, you are usually in what's called a pre-diabetic state. So your pancreas is actually making a lot of insulin. So type 1 diabetes, they're not making any insulin at all because the cells have been destroyed. Type 2 diabetes, even before you are actually diagnosed with diabetes, you are making a ton of insulin because one doorman is failing, and so out comes another little molecule and a third little molecule and 10 molecules. And so the body is making all of this insulin trying to get that blood sugar out of the sugar out of the bloodstream, okay? So if the insulin resistant state is not addressed, then the condition will get worse over time. And this is why newly diagnosed diabetics start off, they usually start them off on a medication called metformin. That's usually the first medication. And then they start to add a second medication, and then a third medication, and a fourth medication. I've seen people on up to 3 or 4 oral medications, diabetic medications. There's some new ones out, and they're fancy and stuff, Januvia and all this stuff. And then finally what happens? None of those are working, or they're not working well enough. Person is still having increased blood sugar levels, and then what do they move to as the last resort? What medication do they put them on? On insulin itself. Okay, so they start to have to take insulin shots, okay, to try and get the blood sugar under control. So eventually, for many, the time comes the pancreas can no longer keep churning out those huge amounts of insulin. The pancreas is tired, and there are not enough doormen to open the insulin-resistant doors. Sufficient amounts of sugar can't get into the cells, the blood sugar rises, and then diabetes is diagnosed. You go to the doctor, and they're like, okay, you have diabetes. So what happens to the sugar that can't get into the cells? So the sugar that can't get into the cells, that's hanging out in the blood, ends up being stored as fat, okay? Accounting for the weight gain that accompanies the cycle. So that's why you find that either right before or right after usually you're starting to gain weight before you're actually diagnosed. So you start to gain weight, and there's a particular organ that's affected kind of first and mostly by this increased blood sugar level, and that's the liver. Because like I said, the major blood vessel that leaves the gut stops by the liver first. One of the reasons why the liver ends up being a site of metastasis for a lot of different cancers, because stuff is leaving the stomach and then it goes to the liver. So the first organ that's affected by increased blood sugar storage is the liver, okay? And so there's a particular newer type of disease called NASH, and it stands for non-alcoholic steatohepatitis. So it used to be that cirrhosis was the major killer in terms of the liver. Alcohol toxicity leading to cirrhosis was the major form of liver disease. And most of the people that came in to have medical treatments done, they were alcoholics. And then the second one that we would see is hepatitis B. But we don't have hepatitis B that much among Americans. You see it more people coming from Asia. They still have chronic hepatitis B. So you have younger people that may come in with cirrhosis from hepatitis infections. We have a lot of hepatitis vaccines, so that's taking care of that. NASH is a new form that I'm seeing quite a lot. And these people are not old. They're in their upper 40s and 50s and 60s. And so non-alcoholic steatohepatitis essentially is fatty liver. You end up having fatty liver, which goes to a NASH liver, and then that in itself is causing cirrhosis. So I actually work with, one of the nurses that I work with, she, well, her decision, there are certain trees that you have to go down when you get these diagnoses and decide what you're gonna do. Some people figure that they can't, it's just too hard a hill to climb to go down the diet and exercise route, and they end up having surgery. So she ended up having bariatric, and I'm not gonna judge, at least I'll talk about that offline, but she ended up having bariatric surgery, and so she was able to lose a lot of weight. And her impetus for going that route was the fact that she had just been diagnosed with diabetes, and her doctor had told her she had fatty liver. And if you're a nurse, you know that fatty liver is sending you to cirrhosis. You're heading for liver failure. So that's one way that you can deal with this. It says non-alcoholic steatohepatitis is a more serious form of fatty liver disease. The liver becomes inflamed, so you're talking about inflammation, and can lead to scarring and irreversible damage. And this is similar to the damage caused by heavy alcohol use. In severe cases, the non-alcoholic steatohepatitis can lead to cirrhosis and liver failure, and is likely to affect older people, those with diabetes, and those with something called, those with a lot of belly fat. That's what that says. Those with a lot of fat around the belly. So, let me see if I can find that slide here, hold on. Yeah, those with fat concentrating around their belly. And then the fatty liver disease risk factors, people who are overweight, obese, have diabetes or metabolic syndrome, which we're gonna talk about a little bit more what metabolic syndrome is. They're more likely to develop NASH. Fatty liver disease is becoming more common in the United States and other countries too. Fatty liver affects over 80 million people in the US, or about 25% of the country. 25% of the country has fatty liver, which means 25% of the country is probably a little bit overweight. It's one of the most common causes of cirrhosis of the liver. Excess fat in the liver can also be caused by excessive alcohol use and certain medications or inherited liver disease. Okay, so there's good news though. If you decide that you don't want to go down the surgery route, and that works for some people. People have surgery and some of them are able to keep it off, not without a change to your lifestyle. Whether or not you have surgery, you have to decide to change your lifestyle. So if you're morbidly obese and you figure that surgery is the way to go, then you still have to be prepared to change your lifestyle. If you go back into the same diet that you were eating after you have the surgery, you will gain the weight. And what I've seen is that 2 years down the road, people tend to gain the weight back. And not just do they gain the weight, but they have a lot of other issues, digestive issues and nausea and problems with mineral deficiencies, because they have literally taken away a big part of the stomach. And yeah, it can be a kind of roller coaster for some people. Some people do really, really well. But regardless, the point is that insulin resistance is largely reversible. We don't have to go down this track. If we did nothing with our health and we just ate the regular American way, we would probably all end up with NASH. It's just the natural thing to do. If you don't have an awareness of how you're supposed to eat and the things that you need to do and changes that you need to, and the discipline to make those changes, we would all end up there. So this is not anything that's strange or far from us. But if we address the underlying cause of the insulin state of diabetes, then the underlying cause of the insulin, then the diabetes can go into remission. And this is where the Methuselah factor comes in. Poorer blood fluidity, if you have bad blood fluidity, okay, is connected to insulin resistance. So if you have increased viscosity, if your blood is kind of thick, if your cells tend to aggregate together, if your platelets are too activated, or if you have a higher platelet count, if you're tending to form a lot of fibrinogen and clots and stuff, poor blood fluidity is connected to insulin resistance, even without the diabetes. Higher than optimal insulin levels lead to increased RBC, or red blood cell aggregation. So if you're in a state where your insulin, you're probably not even diagnosed with diabetes, but you're in a state where you're pre-diabetic and you have all this insulin being produced, okay, because your cells are becoming resistant to insulin, then that higher insulin level in itself causes increased red blood cell aggregation, and this then impairs optimal circulation. So there's a video that I'm gonna have you guys look at that explains the metabolic syndrome a little bit better than I probably can.
What is metabolic syndrome? Metabolic syndrome is a group of conditions that make a person more likely to get heart disease or type 2 diabetes. How is metabolic syndrome diagnosed? To have metabolic syndrome, a person must have at least 3 of these 5 conditions. 1. Waist circumference for abdominal obesity. A waist circumference of equal to or greater than 102 centimeters in men and equal to or greater than 88 centimeters in women. You're yet 1 point. 2. Fasting blood triglycerides. Triglycerides are fat-like substances in the blood. You have high triglycerides if your triglycerides are higher than 150 milligrams per deciliter. 3. Cholesterol levels. HDL is the good cholesterol. That's because having high HDL levels lowers your risk of heart attacks and other health problems. You have low HDL cholesterol if your HDL is less than 40 milligrams per deciliter if you're a man, or less than 50 milligrams per deciliter if you're a woman. 4. Blood pressure equal to or greater than 130 over 85 millimeters of mercury, or drug treatment for elevated blood pressure. 5. Fasting plasma glucose, FPG, equal to or greater than 100 milligrams per deciliter. All the cells in your body need sugar to work normally. Sugar gets into the cells with the help of a hormone called insulin. If there is not enough insulin, or if the body stops responding to insulin, sugar builds up in the blood. If your blood sugar is greater than or equal to 100 milligrams per deciliter when tested after you have not had anything to eat or drink for 8 hours, you get another point of metabolic syndrome. Why is metabolic syndrome important? Metabolic syndrome is a group of risk factors that raises risk of heart disease, diabetes, stroke, and other health problems, and it makes frequently serious and long-term complications. Hardening of the arteries, atherosclerosis, diabetes, heart attack, stroke, non-alcoholic fatty liver disease, peripheral artery disease, cardiovascular disease. How can metabolic syndrome be prevented? You can lower your chances of getting metabolic syndrome by losing weight if you are overweight, eating lots of fruits and vegetables and low-fat dairy products, but not a lot of meat or fatty foods, walking or doing some form of physical activity on most days of the week, and in general, being as physically active as possible, quitting smoking if you smoke. How is metabolic syndrome treated? Diet. Healthy diets that can help you lose weight include the Mediterranean diet. This diet is high in fruits, vegetables, nuts, whole grains, and olive oil. It can help to lower your weight, blood pressure, and blood sugar and improve lipid levels. The DASH. Dietary Approaches to Stop Hypertension diet. This diet is low in salt and fat. It includes 4 to 5 servings each of fruits and vegetables and 2 to 3 servings of low-fat dairy products per day. This diet can lower your blood pressure, weight, and blood sugar and improve lipid levels. A high-fiber diet. Increasing dietary fiber to at least 30 grams daily can lower blood pressure and weight. Fiber is normally found in beans, grains, vegetables, and fruits. Table 2. The nutrition label on packaged foods can show you how much fiber you are getting in each serving. Figure 2. Exercise. Doctors recommend that people exercise at least 30 minutes a day on 5 or more days of the week. If you can't exercise for 30 minutes at a time, try to exercise for 10 minutes at a time 3 or 4 times a day. Brisk walking is a good choice. Medicines. Doctors often recommend medicines to lower blood pressure, blood lipids, and blood sugar.
So when persons with metabolic syndrome are studied, they end up having less than optimal hemorrheology as well. Like I said, the good news is that insulin resistance is reversible. The more insulin receptors a person has, the worse his or her fluid, the blood fluidity. And this is indicated by certain markers. They end up having increased plasma viscosity, they have elevated fibrinogen levels, and they have increased hematocrit. These are the same 4 markers that we talked about last week, Sabbath, that increase your risk of stroke, okay? So when you have increased insulin resistance because you're taking in, your diet is kind of off, okay? So the foods that you're consuming are more high glycemic index foods. Do you know what that means? When I say glycemic index, what that refers to is the tendency of the food to spike your blood sugar, okay? They're foods that cause you to have a kind of, let's say this is the bottom of the graph. There are foods that will cause you to rise slowly and you know, your blood sugar does like this and it comes back down. And then there are foods that do like this. You have a higher spike, okay? So in other words, your blood sugar is going a lot higher. Those are higher glycemic foods. So a person that has a lot of insulin because of the choices that they're making with their diet, their blood fluidity, in other words, what's happening in the blood, these are some of the things. You have increased plasma viscosity, which makes the blood thicker. You have elevated fibrinogen levels, and you have increased hematocrit. Another hemorrheology impairing factor that those people with metabolic syndrome have is inflammation. So diabetics tend to have, or pre-diabetics tend to have increased inflammation in the body. And inflammation can be triggered by surgery, it can be triggered by infection, it can be triggered by trauma, other diseases, and lifestyle choices can also trigger inflammation. So when I say inflammation, what do I mean? If you remember the talk about COVID and what COVID was doing in the very first months of COVID when people got it, how it was the spike protein on the virus was triggering an inflammatory response, and the body, seeing this foreign body in it, which was the spike protein, was going crazy in some people. And you were getting what we call a cytokine storm, right? That was putting certain people on a pathway where they had a lot of fluid in their lungs and they had problems breathing and they had heart attacks. That's an inflammatory response. Just to give you an idea of what an inflammatory response is a response of the body to something that it doesn't like, so that the body kind of gets up in arms and you have all these cytokines that start putting out chemicals that are harmful to tissue around it. So it's in response. The inflammatory response is a response to something that's happening in the body that the body does not like, okay? So inflammation can be triggered by surgery, by trauma, by infection, certainly like it was with COVID, and certain diseases, and then lifestyle can also trigger inflammation. With the inflammation, also comes worsened blood fluidity and an increased risk of diabetes. So when we carry extra weight around our midsection, the fat cells themselves that we have pump out inflammatory boosting compounds. So just having extra weight, tends to cause you to have more inflammation because the fat cells are putting out the inflammatory boosting compounds. Are you following me so far? Okay, good. So now we have like the chicken or the egg question. Does the metabolic syndrome cause the Methuselah Factor abnormalities, or do the Methuselah Factor defects, does that tend to foster insulin resistance? And just so I'm clear, if you were not here last week, the whole Methuselah Factor, the factors that we listed at first, increased hematocrit, plasma viscosity, and the tendency of cells to aggregate and form clots. Those were some of the things that were negatively influencing your Methuselah Factor. And there were several things that we talked about that can improve your ability to live longer and improve the blood's ability to flow, because circulation is life, and lack of circulation leads to decay and death of the tissues that are downstream, okay, of whatever is being gummed up. So diabetes, in terms of the question that I just asked, does the metabolic syndrome cause the Methuselah Factor abnormality, or do the Methuselah Factor defects foster the insulin resistance? It's kind of both are true. They both influence each other. In other words, insulin resistance impairs hemorrheology, but poor hemorrheology also worsens insulin resistance. So it's a back and forth relationship. Now in diabetics, one thing that you find is what we call microvascular dysfunction. In other words, all that means is dysfunction in very small blood cells, like in capillaries, for instance, or in very small arteries. So microvascular dysfunction, by affecting the flow resistance and affecting tissue perfusion, it plays a role in both the development of hypertension and also development of insulin resistance. So like I said, microvascular, micro meaning small, like you have to use a microscope to see it. So microvascular refers to small cells. They don't relax properly, and because they can't relax properly and they tend to be vasoconstricted, they don't relax properly because of increased levels of insulin. And so because they're not relaxing properly, they tend to decrease the blood supply to the tissues that are downstream of those vessels. So if you have poor circulation, then your insulin resistance worsens. It gets worse. So the factors that worsen blood fluidity, the factors that cause us to want to clot, are also associated with worsened insulin resistance. In other words, the two go hand in hand. Are you guys following me so far? They're interconnected. One causes the other, and the other causes the first. Why is this? Why would poor tissue blood supply, which comes from poor tissue blood supply, in other words, tissue that is not getting adequate blood supply, which comes from suboptimal hemorrheology, why would that be linked to insulin resistance? So here's the relationship. Suboptimal blood flow is occurring in your small blood vessels, and then because of that, you have decreased oxygen to the blood that's actually lining those little endothelial cells where the oxygen goes through, and this adds to the oxidative stress in your body, and this impairs the ability of the blood vessels to relax. So it's all interrelated. One causes the other, and it goes into a vicious circle and vicious cycle. And then oxidative stress itself worsens insulin resistance. And then the other piece is that in order for insulin to do its job, it actually has to reach to the site of action. So the doorman, which is insulin, can't open the door if it's not there. So if you have blood vessels that are not working properly, if you have vasoconstricted vessels that are not allowing the insulin to come through, then the insulin can't take the blood sugar out of the cells, okay? There was a study the insulin cannot take the blood sugar out of the blood to put it inside the cells. There was a study that was done by Dr. Wang and colleagues, and this was U.S. atherosclerosis risk in community study. That's what it was called. It was about U.S. atherosclerosis risk in community. 8,000 people were involved, and they were between the ages of 49 and 74. And initially, when they started the study, nobody had diabetes. They were all initially diabetes-free. At the outset, what they measured was the tiny arteries in everybody's retina in the eye, because they're easy to see. That's what if you go to an optometrist or an ophthalmologist, they're looking at when you go to get glasses, they're looking at the back of your eye to see the vessels, and they can tell you if you're diabetic or not. And they can tell you if your body is healthy based on those blood vessels, the sizes of the vessels, and also if they're seeing a lot of different and new blood vessels forming, okay? Because new blood vessels may form because others have been blocked. All right, so then you have all this new blood vessels going on. So anyway, they measured in this study the size of the tiny arteries in everybody's retina, and they called it the AV ratio. So they measured the sizes of the arteries, and they measured the size of the veins. So A for arteries, V for veins. So it was called the AV ratio, and this was a comparison between the sizes of the arteries and in relation to the veins. If the small arteries, this is just a general, if small arteries in your body, in my body, if they're exposed to anything that's unhealthy, any sort of unhealthy situation, the arteries tend to decrease. So whenever our body encounters a chronic, unhealthy situation, okay, the blood vessels tend to shrink down. They constrict, they vasoconstrict, and they decrease in their size relative to veins. So they followed these subjects, 8,000 people for 3.5 years, and they were able to diagnose new cases of diabetes in about 300 people just based on the measurements in their eyes. They weren't testing their blood, they weren't doing anything else. They were just looking at the sizes of the arteries. And during that 3.5 years, they had at least 300 people who had changes in the size of their arteries, their retinal arteries. And that caused them to then test them and diagnose them with diabetes. So if you consider what's happening in the small blood vessels in the eye, this is also happening in the blood vessels throughout the entire body. So before you're even diagnosed with diabetes, if your body is set up where you're having unfavorable or an unhealthy situation for those cells, the arteries tend to be shrinking in size. And so this happens throughout the entire body. And impaired circulation in your tiny blood vessels then increase your risk of developing diabetes. So if you already have a diagnosis of diabetes, the better your blood fluidity, the less your risk of developing a diabetic complication. So if you don't have a diabetes diagnosis, then we're going to be working towards not getting a diagnosis. But if you are diabetic, if you have a diabetes diagnosis, the thing to know is that there are things that you can do to decrease your risk of having complications from diabetes. The better your blood fluidity, the less your risk of developing those diabetic complications. So even if you have a diagnosis, you can take steps, like I said, to decrease your risk of complications. There was another research that was done at Drexel University in Philadelphia, and they concluded in that research that increased blood viscosity adversely affected the microcirculation in diabetes, leading to microangiopathy. Microangiopathy just means disease in small blood vessels. Micro meaning small, and pathy meaning disease, and angio referring to the blood. So microangiopathy, we're talking about diseases in small blood vessels. increased blood viscosity, the thickness of the blood, adversely affected the circulation in diabetics, and that led to microangiopathy. What this means is that diabetes worsens the Methuselah factor by negatively impacting blood viscosity. This, in turn, worsens circulation in the tiny blood vessels, leading to microangiopathy. So again, it's a chicken and the egg situation where one is influencing the other, and it's coming back and influencing the first. So the small blood, so that's why you end up having small blood vessel complication in diabetes, in diabetics. These small blood vessels, the changes in the small blood vessels lie at the root of why many diabetes end up having common side effects. What are some of the problems that we end up seeing as diabetic complications? Does anybody name off a couple of things that can happen with diabetes after it goes unchecked for a couple of years? Blindness, that's at the top of my list. So the blindness part is because, as you saw in that study with the 8,000 people, that was a big study, right? They diagnosed 300 people with diabetes just by measuring the size of the arteries in their eyes. What was happening to the size of the arteries in the diabetics? They were getting smaller, right? So what happens is as you have arteries decreasing in size, and some of them probably being completely blocked off because of lack of blood flow, because of all the physiology that goes along with that, they're vasoconstricting. There are other arteries that you get what we call new vessels, and these vessels don't always chart a path that allows you to see. They may block the optic nerve. And so you find that diabetics, the other thing is that diabetics have hemorrhages in their eyes. So you have a lot of, what we call diabetic retinopathy leads to blindness. Any other problems that diabetics can end up with after a few years? Amputations, amputations. So they end up with nerve problems. It doesn't start with amputations, but it certainly ends there. Nerve problems are neuropathies. They have pain in their feet. They have numbness and tingling in their feet. They have infections that don't heal well. They don't feel things because the nerves are not being well nourished. So things that would cause someone else pain, like they may step on a nail or they may have a little cut on their foot, they don't feel it. So they don't always know to take care of their feet, and then so they end up with infections and non-healing wounds. That then leads to amputations. And the amputations usually, they start with taking off a toe. Then they'll take off another toe. Because usually people don't want to lose their limbs. And the doctors they don't necessarily want to lose their limbs. But when we're in surgery, we're usually like, that person's going to be back. You know, because they're trying to take as little as they can take. We don't even have to give that much anesthetic sometimes because the area of the foot is so devoid of nerves because of lack of blood flow or infection that they're not really in a lot of pain, unfortunately. So whereas someone would have to be completely knocked out, sometimes we don't have to give them because they're not really feeling the amputation. So it's really sad. So they end up with a toe and then half a foot, and then they have like a BKA, like a beak below the knee amputation, and then sometimes they have to have an AKA. So they end up losing their limbs, specifically usually their lower extremities. What else do diabetes end up with? Diabetics. So they definitely are high risk for stroke, because if you're going to have problems with your eyes and with blindness, then you can imagine you're also having narrowing of cerebral blood vessels as well. So definitely are high risk for stroke. Then the other things that they can have, men end up with a lot of erectile dysfunction because again, they're small vessels. Kidney failure. After a while, a lot of diabetics end up on dialysis because the kidneys are filled with very small vessels, and it's a filter area, and those proteins, the excess sugars, causes a lot of complexes, and they have a lot of issues. And then coronary artery disease, so coronary artery disease and strokes. And then the liver, so the NASH, the non-alcoholic steatohepatitis, which if that's unchecked, then you go into fatty liver, and then you go into cirrhosis and liver failure. So poor hemorrheology will up or increase your chances of succumbing to macrovascular or large vessel complications, and those are the ones that we just talked about. These are complications that increase the risk of diabetes, related killers like heart attacks. So all those things then lead to heart attacks and strokes, like we talked about. Type 2 diabetes is reversible. And you don't have to be stuck on a medication or 2 medications or 3 medications or 4 medications or insulin. There was the story was told about this is a true story. I can't remember what book I read it in, but this guy was in his late 50s, and he came in to his doctor, and they checked his cholesterol ended up being like about 300. So the reason actually why he was diagnosed is because he had these things on his skin, like bumps on his skin. They were kind of yellow, and he was of the lighter hue. So they can see deposits, which if you look, sometimes we can see it in our own skin color too, but you have to know what to look for. They're kind of yellowish deposits around the eyes. And so because of that, the doctor tested his cholesterol, and it was about 300, and then his blood sugar was above 200, and the doctor was like, "You're gonna have to go on insulin because your blood sugar is too high, like you have to go." And he was like, "No, I don't want to go on insulin. I will not go on insulin." And the patient went out and decided to change his lifestyle. He made some major changes to his diet, and he started to walk every day. And within the course, I think it was within the course of a year, he lost like 50 to 60 pounds because he refused to get on insulin. So sometimes we all have to have that aha moment where we're like, we're not going down that road. And then you try to do what you can to change things and just move things in the other direction. We can do it. So type 2 diabetes is reversible in many cases by following a diet and lifestyle that addresses blood fluidity. So if you have either type 1 or type 2 diabetes, you can decrease the risk of complications by paying attention to your hemorrheology. So there are challenges that we did before, and the challenges that we did on last Sabbath. Slide. The first one, really, really important. These challenges all together are gonna do so much good for your lifestyle, your body, your hemorrheology. In other words, your blood situation, fluidity. The first challenge we did last week was water up, where we talked about making sure that you're increasing your water consumption. Your ideal body weight, okay, divided by 2, drink that amount in ounces. It ends up being between 6 and 8 glasses for most adults, okay? And then 6 to 8 ounce glasses of water. And then the second one was alcohol down. So in other words, consuming alcohols don't really help the situation, and there's just so much risk that goes along with it. Number 3 was call your blood bank. We talked about the fact that donating blood actually helps you. It helps to thin out the blood a little bit. You get rid of some of those cells. You're helping the people who are receiving blood from you, and you are taking iron load off of the liver, and there were several other benefits. Go listen to the first lecture from last Sabbath if you didn't hear it, about the benefits of giving blood. And then on Wednesday, we talked about, with cancer, we talked about eating more plants, specifically the cruciferous vegetables, okay? So the vegetables that live in the cabbage and Brussels sprout family, the turnips and greens and kale and spinach, those vegetables specifically really decrease your risk of cancers, and they will also do you a world of good in terms of diabetes and stuff like that. And then the challenges that I'm going to bring to you today What can we do to improve how insulin works in our body? What can we do to improve our insulin sensitivity? Make sure we're not going into an insulin resistant state, okay? Number one that I want to advocate is for, especially if you have diabetes or you're pre-diabetic or you have, you're having those type of issues, you need to measure. So what do you need to measure? You need to measure your blood sugar. You need to be measuring your blood sugar every day. And actually you need to be measuring your blood sugar probably multiple times a day. And the reason is because if you're doing this, it will give you an idea of what foods, how your body is responding to certain foods. You will pick up, you will realize, you'll hone into the foods that cause your blood sugar to spike. And so in other words, the foods that have a higher glycemic index. So what I pay attention to, I pay attention to the foods that are downers for me. The foods that cause me to feel blah. Okay? That's important because of my job. I'm in the OR. You don't want your anesthesiologist falling to sleep on you, do you? So, right, you want to be asleep. You don't want me to be asleep. I have to pay attention to the foods I eat during the day, especially if I didn't get enough sleep last night. I have to pay attention. So I have come to realize that certain foods that I eat, like nuts and grains, never make me sleepy. I can eat nuts. I can snack on nuts all day. Don't eat pasta. Because pasta breaks down to simple sugars. You get a crash, right? Don't eat ice cream. Don't eat cookies. Don't eat donuts. Not during the day. For me, those things are going to make me sleepy. They'll do you like this for a little bit. Your blood sugar goes up. They have a very high glycemic index. You're going to crash. With the crash, you feel blah. You don't want to do anything. It takes your energy away. Why do you want to consume foods that take your energy away? Okay, so measure your blood sugar, but also measure your weight and measure your blood pressure so you know what's happening, okay? And then the other thing that you need to do is be big on beans. Different beans, they're known to stabilize your blood sugar. Choose your favorite type of beans, but try to have beans every day. Twice a day if you can, because they're really good they have a low glycemic index, and they tend to they're filling, there's a lot of fiber, and they just kind of even things out, so you don't get that big spike in your blood sugar. It goes up a little bit, but keeps you fuller for a long time. So beans and oatmeal for breakfast. That's another food, and I'm talking to myself because I love eggs. It's probably my favorite food. But, there's so much debate about eggs these days, especially if you're eating the yolk. All right, there's a lot of cholesterol in egg yolk. Oatmeal, on the other hand, especially the steel cut oatmeal, big source of fiber, keeps you full, but it doesn't tend to do this. It tends to gently bring your blood sugar up and keeps it like this, and it also keeps you really, really regular. So if you do oatmeals with chia seeds and flax seeds, because we need our omega-3 fats, very, very important to cell membrane repair and function, all right? That's gonna help to stabilize your blood pressure. So be big on beans, increase your bean intake, and then focus on fats. Try to avoid saturated fats, generally found in animal products. So, not everybody could be a vegan. It's not gonna happen. But even if you're not, if you can move towards that, then I applaud you. It's the best thing in the world, honestly, for your health. But there are other things that you can do. Increase your vegetable consumption. Go green. We forgot that one. We talked on Wednesday about the fact that you needed to go green and have a day of fasting from meats and dairy products, where you increase your, just increase the consumption of the cruciferous vegetables and fruits and stuff like that. Just eat stalks, leaves, and flowers 1 day a week. Kamal is like, what? Broccoli is a flower. So stalks and leaves, Brussels sprouts, cabbage, kale, greens, and then flowers would be like For sure, broccoli. I can't think of any other flowers. Can you think of any other flowers? But broccoli is really one of those foods that is very filling, has a lot of fiber, really good for you, has a lot of chemicals, phytochemicals that are really nutritious for you. And then, so focus on fats. Try to decrease your animal consumption. If you're gonna still eat meat, then stay away from the fat of the meat and make the veggie part of your plate big and the meat part really, really small. Balance it. Do it for flavor. You flavor the food with the meat, but focus on the veggies, especially the cruciferous vegetables and beans, right? And you're gonna do a world of good for your hemorrheology if you do it like that. So the saturated fats significantly increase insulin resistance, helping to ensure worse blood sugars when you do actually consume carbohydrates. And like I said, increase your consumption of omega-3 fats. You can get them from fatty fish like salmon, that sort of thing, but you can also get them from flaxseed and chia seeds. So what I had been doing, and I have to get back to it, is oatmeal with flaxseed and chia seeds, and those things actually keep you very regular. So walnuts, flax seeds, and chia seeds. Increase your bean consumption. Try to go down on your saturated fat. So if you're eating eggs, let's get rid of a lot of the yolks and maybe eat more egg white and not as much, because the yolk has a lot of cholesterol and fat. All right? And then the fourth challenge being, let's try to move more. We're going to have a whole presentation on Wednesday, actually, on you need to move it. This guy is, in terms of his qualifications, he's so well qualified in terms of what he does and he presented for us sometime in the past. His name is Neil Davis. You guys remember him? He's presently the adjunct professor in Natural Sciences, Department of Northern Virginia Community College, wellness director and health educator, certified trainer for over 22 years, and he has a Master of Science in exercise science. So he's going to present on Wednesday on moving it and the importance of exercising. So before we get to Wednesday, let's try to determine to walk a little bit more every day or do some weights. So whatever it is that you need to do to try and increase your make sure that you're trying to increase your physical activity. All right, and those things will help you in your journey of fighting diabetes or staving off diabetes so that we can stay healthy into the future. Any questions? Any comments? I think that mic there, you might be able to use it. She had a question. Is it on? Yellow mic. You probably could hear me. Yeah, go ahead. Okay. No, use it. Use the mic. Online, it may not be able to hear online. It's on.
It is? Oh, okay. I know you were talking about the plastic, which I feel really bad because I didn't drink it.
Don't feel bad. I had a plastic bottle up to last week's Sabbath until I did my research.
But my son had also mentioned the glass.
Yeah.
But I was wondering, what you thought of like the purifying pitcher, which is also like hard plastic, but if we let the water go through and we transfer it to glass.
You're talking about the big the huge pitchers?
Like the Brita, yeah, the Brita pitchers. Is that considered plastic? I mean, it's a hard plastic, but it's not sitting,
Yeah, it might be a firmer, safer plastic. I'm not really sure what that looks like. Cynthia, do you know? Yeah.
Some plastic actually will say BPA free in those Brita filters. I'm assuming that's what those are because they have like a carbon filter. So you just have to look and see to make sure what kind of plastic your water's going to be in. And you're not going to keep it in there for a long period of time, nor is it going to be exposed to the sun. So that's the other piece. Our water bottles sitting in our car is an issue, or a lot of people will get their big 24 count of water, and they'll sit it by their window in their kitchen, so it's being exposed to sunshine. So keep that in mind. It's like what the plastic is made out of, and then where you're positioning that plastic.
Yeah, because I didn't realize, I've been doing, it's so convenient to just have a bottle of water, right? We all know that. But I leave mine in my car like all winter, and I was also leaving in the sun in my car during the summer in the trunk. That needs to not happen, because that plastic is actually getting into the water. And actually, they even found micro plastics in bottled water that were bottled in glass. Okay, so we just have to be really careful. If they're less than 150 microns, then they can leave the gut and head into different organs, especially the liver. And like I said, the plastic caused tumor formation in fish. So yeah, the BPA-free plastics are probably okay, but if you can avoid plastics in general, in terms of your food too, then you're gonna be better off.
Something else I thought of, I usually in the past didn't keep my water in the car because of the same reason, but then I was at a gas station once, and then I was going to the store to buy water, and when I was heading in, I saw cases and cases of the water sitting by the side of the store in the sun. So not only is how we are storing it, we don't know how they store it to the wet, so it's kind of, when I saw that, I'm like, yikes. I mean, I'm trying my best, but I don't know where it's coming from and how they store it. So that's something else to consider.
And not only that, but yeah.
I'm actually going to put the mic here so you can ask the question at the mic.
So it's sitting in the sun outside the gas station, but we don't even know where it came from before that. We have water that's coming from all sorts of different countries in those little plastic bottles. They might have been sitting in the sun or sitting in the heat in ships, right, while they're being shipped here. So because we don't have that information, we really have to be very, very careful.
Hi, I have a question. If you can talk about the timeliness of our eating, especially when it comes to reversing type 2 diabetes. Are we supposed to be eating every 2 to 3 hours? What should we be eating, especially, and then if there's any resources that have meal plans that are helpful for vegans who are trying to do type 2 diabetes reversal? I
have some pamphlets on the back table that will talk about how to eat to be cancer and diabetes free. Some people are engaging in intermittent fasting, which seems to be very helpful for those who have the discipline to do it, so that they're trying to consume their calories in a limited time frame, which tends to decrease the amount of calories they consume overall. So that is helpful. In terms of, there are two schools of thought. There are people that eat small meals spaced out throughout the day, making sure that you're consuming more protein and complex carbohydrates rather than simple carbohydrates, okay? So foods that have one word would be probably better than really complex processed foods. So the focus should be on plant-based whole foods rather than plant-based processed food that comes from a can or a box. Does that make sense? If you're exercising, I know for like people who are doing weight building, they tend to eat smaller meals throughout the day because the emphasis is on not storing. They want their bodies to use up everything that is put in it, okay? That probably, I know a lot of diabetics that seems to work for, but portion control is gonna be important if you're doing several small meals throughout the day. Portion control and also what you're eating. to make sure that you're eating more protein-based foods and limiting your consumption of especially simple carbs, as well as making sure that you have an exercise regimen that includes at least 30 minutes of doing something active per day. And I'll have to see if I can find additional information for you if you need more details than that. Well, it's 6:30, and if there are no more comments or questions, we're gonna, go ahead, Pam. Can you use the microphone just so people online can hear you too?
Okay, for inflammation, can you use turmeric for
Turmeric is a great anti-inflammatory agent. So turmeric or curcumin, what's it called? I'm messing that up. Curcumin or something like that. I like turmeric. I take turmeric as a supplement, or if you put it in your food, curcumin, I think it is. But it's a good anti-inflammatory supplement. Turmeric, ginger, garlic, especially high allicin garlic, very good. So we need to be consuming it in our foods, and if you're not consuming it in your foods, then turmeric supplements are good. It's anti-inflammatory. All right, so Wednesday evening, the program starts at 7, and I want to invite everybody to tune in. We're going to, I need maybe a couple of minutes, maybe 10, 15 minutes. There are not a lot of us here, but if you're interested in having your cholesterol checked, we're going to try and see if we can do some checks downstairs. Okay? Next week, Sabbath, Dr. Davoy Murray will be presenting on everything to do with the heart and blood pressure as well, and the importance of maintaining normal blood pressure, the importance of that to our health, and then the whole cardiovascular and cholesterol things to do with that. That's going to be next week's Sabbath right here. All right? Let's bow our heads for a word of prayer. Thank you for tuning in. Thank you for those who are here today. Lord, we are so thankful that you have made us, and we are wonderfully made. And Lord, we ask for help in terms of the guidance that we need, the discipline that we need to make the right decisions so that we can be in good health and we can prosper. We ask for your Spirit to guide us in everything that we do, everything that we say, everything that we eat. Be with those of us who are struggling with our health, struggling with our weight, and just give us the resources, help us to make decisions that will enable us to be here and to be a witness in the long run, and help us to make decisions that will help us to feel better as well. And we look forward to that day when we'll be able to eat the leaves of the tree, which are going to be made for the healing of the nations, and we'll be able to pick the fruit off of the tree of life, and we will not have to worry about aging or disease or dying. We look forward to that day, Lord. So we ask that you hasten your appearance. Until that day, keep us, because we cannot keep ourselves. Protect us and save us. In Jesus' name I pray. Amen. We have one additional question online that we missed.
Okay, yeah, there was one question. So sorry about that, Libby. I didn't see your question until just recently. So is it true that type 2 diabetes can lead to dementia symptoms?
Okay, so the thing about type 2 diabetes is that it's the constellation of what's happening in diabetes that could eventually lead you to having dementia. It's the same process where you are decreasing your circulation, your optimal blood flow to tissues in the brain, in this case, where you're having problems with clots and with constrictions in small arteries in the brain, okay? That will cause over time shrinkage of your cortex because it's not being well perfused. It's part of the aging process, but it tends to be accelerated in diabetics. So through that complicated physiological process, the answer is yes, that you're gonna be more susceptible to having dementia, okay? So the same things are gonna help diabetes and are gonna help prevent cancer and decrease your risk of stroke and decrease your risk of cardiovascular disease are going to also improve your mental clarity and decrease your risk of dementia. And so all these changes that we're talking about are changes that are going to improve your circulation, not by taking medications, although if that's necessary, then you need to do that, but by using food and by improving your rheology, drinking more water, eating more of the foods that feed us and that open up our blood vessels and that tamp down our inflammatory response, whether it be platelets or red blood cells, so that blood can flow. You have better mental clarity if blood is flowing to your brain. You're gonna be less sleepy. You're gonna just be able to think clearer and stuff like that. As well as the other thing that really influences dementia that we don't think about is lack of sleep over time. Lack of sleep over time actually can cause dementia. It contributes to dementia in a really big way. So of all the changes, we haven't talked about sleep, but I think I'm going to talk about sleep 2 weeks from today. The importance of getting adequate sleep, because you can railroad your health, eating all the right stuff, drinking all the water, exercising. If you're not getting adequate sleep, you are not doing yourself a favor, okay? Very, very, very underrated. Lack of sleep is so it's such a big factor in leading to dementia. Insomnia. A lot of people that end up having dementia start by having a lot of insomnia. They can't fall asleep. So there's a correlation between the two. So I hope that answers your question. Libby, thanks for tuning in, everyone who's online. We appreciate you. Wednesday, the program starts at 7 p.m. Thank you and have a good evening. God bless.